get folks to take control of their cancer risk, and what can they do. And now we're connected with my friend. We always have some challenges. We got to hear from you, young folks, to teach us. But my good friend, Dr. Mina Murham, who's an assistant professor of psychiatry at Columbia University and a Medscape contributor. Thanks for joining me.
Thank you so much for having me, Dr. Whyte. It's so good to see you again.
And I want to give Dr. Murham credit because he and I talked a lot in the production of this book about the role of our brains, our mood, that mind-body connection that we really have known for thousands of years, but we haven't always done anything about it. And we kind of teased for this Instagram Live, like, what role does mood play? Does a positive attitude play a role in whether or not you might get cancer? And remember, about 30% of cancer is due to genetics, typically inherited mutations. But the majority of cancer is caused by lifestyle, what we eat, how much we are active, the amount of stress in our life, and also, our relationships. It's almost, I've been saying lately, it's food, it's fitness, it's family and friends and fun. So, I really want to start off and ask Dr. Murham, what's the relationship between our mood and our immune system? Does it really exist?
It really does, Dr. Whyte, and thank you for having me to be able to speak on this today and for our conversations kind of throughout leading up to your book. I'm so excited to be able to dive into it. And I pre-ordered my copy. I can't wait for it's. I think it's something that's really on a lot of people's minds, and I get a lot of patients asking me this question too. Is, I have this family history. Is there anything I can really do? And on top of my physical risk, there's also a mental health risk. Could there be a relationship? Could there be something I can do? And my answer is always a resounding yes. And part of it is what we can tell intuitively, right? If you're the viewer and you know that when you feel down, you're always less likely to do things that are healthy for you. You're less likely to go outside, to communicate, to be with folks, to make healthy lifestyle decisions. We know this from the research, though, on the biological level, is that when our brain is in this kind of stress response, cortisol is up, and it's a hormone that's reducing our immune system. And the more that's in play, the more we're in this constant stressful fight or flight mode, the less likely our body is able to fight infection and kind of prevent these illnesses that include cancer. And what we know there was a big JAMA study that even looked at PTSD and how that impacts our cardiovascular health. And I'd love to even hear more about that from you, just kind of what you're seeing from feedback that folks have given you as far as the decisions that they make and how that impacts their cancer risk.
And I'm looking at people's questions. A couple people are asking how we spell our names. I'm Whyte, and Dr. Murham is Mirhom. So Whyte and Mirhom. And there is this kind of feeling, really a positive attitude will help us prevent cancer. They know plenty of people that have positive attitudes, they still get cancer. What's the role of this positive attitude? And then on the flip side, you just try to overlook things and say everything's okay, even though it's not. Let's be honest, it can be very stressful right now during the pandemic. People have lost their jobs, they've lost relationships. There's a lot of things that we can't do. So what's the real role of positive attitude in promoting health and preventing possibly cancer?
That's such a key question, because what we don't want, someone listening to hear is say, well, let's have this kind of toxic positivity, right? We all have this friend maybe who, if it's raining, no, it's okay. There's always kind of this silver lining effect, right? Which sometimes can be good. It's good to find the positive in things that maybe are challenging around us. But what we don't want to do is pretend that everything's okay. That's not what we're saying with this positive attitude. It's not the toxic positivity of not acknowledging pain. For us, both from a mental health standpoint as well as a physical health, it's important to begin by saying, yes, this is a difficult day, or yes, this has been a difficult time, or a difficult year or two with COVID, or a difficult diagnosis that we may get. So we don't want to place this pressure on ourselves to say, no, the positive attitude is that I pretend everything is fantastic. No, some things could be difficult, but the key question for us is, when things are challenging, I can always control my response. A great writer named Viktor Frankl, a psychiatrist who lived through the Holocaust, always emphasized this idea that we can't always determine or control our circumstances, but we can always control our response. So that's, I think, the key here for cancer risk or health risk in general. It's not to pretend that everything is amazing, but to say, what is the role in my response for it to be positive and building and growth oriented?
A couple folks are just joining. We're talking about this new book about take control of your cancer risk. What's the role of your mental health? What's the role of your mood? We always like to give people tips and tools when we talk. So,
Mm-hmm.
we just can't say, well, we're going to have positive attitude and everything's going to be okay. Much more than that, and it takes work just as it does in terms of managing our diabetes, our heart disease. So, Dr. Mirham, what are the tips and tools that you suggest to people in terms of improving their mental health, improving their mood?
I think one tip is first understanding what are the components of our physical and mental health. I sort of remind patients sometimes of the three S's, right? There are these three things that help build up or contribute to how we feel. One is the self, or what we're born with. And as you mentioned, some part of this is genetic. Maybe
Yeah.
you can be predisposed to one thing or another. But one thing we're learning more and more about lately is how you can even impact genetics. And there's even an epigenetic component, is that if you're right, and I'd love to hear you expand on that more. But that's one component.
I mean,
That's not everything.
our, we're actually perhaps changing in how our genes respond. And we do know with cancer, when you make mistakes in your genes, that's what's expressing these abnormal cells. So, right.
Right, which is an incredible thing to be able to think about, is that, hey, I can change for even what I'm predisposed to for the better or for worse. So to know first is that what you start with is not what you end with. That's not the end of the story. The self part is there. The second part is our surroundings. As we talked about here, sometimes your surroundings can be things you may or may not be able to change all that much. There's a famous saying that I really love, which is that sometimes your zip code can have more to do with your health than your genetic code, right?
Mm-hmm.
And I think you talk about that in the book as well, of just kind of these social determinants, the
Right.
things around.
Remember that.
It's a good one. It's a good one, right? So, and for us to be able to understand that, hey, sometimes it's not just what I'm born with. It's not just the things that I started with, but what's around me, my circumstances there too. But then thirdly, which I think is most important when you're thinking about what can I do, what are the practical tips, which is structure. So the third S in the structure is the habits. To know, as you said, that for me to build healthy habits, I'll be honest, sometimes I get inspired maybe by one of your talks or get inspired by someone else, and I have a salad and I say, well, now I should be, I step on the scale, I should have lost weight, I should be super healthy. But the key really is that it's a decision for building healthy habits to build this structure into our lives. And that's what really impacts our risk for cancer as well as other cardiovascular illnesses.
And it's really our daily behaviors over time, right? So we all have bad days where we don't eat healthy, or we don't be physically active, and that's okay, or we don't have good sleep. But it's over time when we engage in more unhealthy behaviors than we do healthy behaviors, where we see that cumulative impact, where things are starting to add up. But you're a big proponent of this, mind-body connection. What
Mm.
are your other thoughts in terms of what people often misunderstand about it, right? They kind of dismiss it, even though inherently they know when they're stressed, they can feel it in their body, literally, either palpitations or sweating or nauseous, but then they don't make that connection overall to you think about it in terms of your acute stress, but chronic stress, as you kind of pointed out, and the role of cortisol and other hormones, that's really where we're seeing on the impact of immunity, aren't we?
That's absolutely right, Dr. Wright. And I think that's the difficult thing for folks to connect, as you mentioned, is that we sort of live in a stress-bathed environment, that this is the norm, where sometimes we have to just take a second to pause, and this is what we advocate for in mental health as well. Sometimes if you're just going through the motions in your life and you're seeing, well, I can't be that stressed out if my family's stressed out, my friends are stressed out, my coworkers, we're all in this kind of baseline level of stress all the time. We'll say, wait a second, maybe I need to hit the pause button. Just,
Yeah.
wait for a second and see this level of stress, while it can seem that we've gotten used to it, just because you've gotten accustomed to it doesn't mean it's healthy and normal. And I think recognizing that there is a lot that you can do. And when you make a change in your lifestyle, in your behavior, in your day-to-day routine, that both has a positive cycle that you can start to get into. And this positive mind-body connection, there was a really great study out of Harvard that looked at 75 years of just what's the most impactful sort of wellness measure that we can take. And they saw that the more we invest in relationships, and there are specifics maybe that we can even get into, these four F's that I sort of boiled it down to, the more that there can be an impact on our physical and our emotional health too.
We talk about some tips in here. Just read you a few. So we talked about them before I wrote it, and I'd just like you to comment a little bit on them when
Sure.
tools. I talked about from, really engaging with you on these different things where we say schedule gratitude.
Mm.
What does that mean?
What it means is, so there is a powerful phenomenon that we've seen, which is the brain will learn to find what you teach it to look for. For example, if over time you've sort of almost inadvertently programmed your brain to find the challenges in things, the most difficult situation, that reinforces sort of a cycle of somewhat negative thinking and finding the most difficult thing.
Mhm.
The flip side of that is gratitude. You can actually retrain your brain, and studies have shown us that even taking a simple exercise of scheduling 3 elements of gratitude in your day. This could be just as you're going to sleep and you think about 3 things that I'm grateful for and why I'm grateful for them. It could be that I'm grateful right.
Gratitude journal. I mean, some
Right.
people, that's corny, but really over time,
Right.
rewire your brain. What
Absolutely.
what about this concept that we've talked about is practice forgiveness? And
Mm.
some people are still holding grudges against people from a wedding that occurred 20 years ago, didn't send a nice gift for. But what's the importance of forgiveness as we think about our mood, our mental health, and ultimately our immune function?
It's so key, because what we know from the data is that we sometimes have this feeling that if I'm holding on to a grudge, this is a way for me to sort of be angry with the other person, as if it's going to hurt them, right? But years ago, as you mentioned, or years later, that person has long and forgotten about it. But what it is doing is it is impacting my health and the way I feel and kind of my day to day. There was a beautiful study that looked at an acronym called REACH, which is the sort of 5 elements of forgiveness that we've talked about. And the power there is that when we're able to forgive others, this can seem like just an ethical or sort of altruistic thing, but even if you're doing it specifically for your own health benefit, it's incredibly powerful, and you can sort of feel yourself exhale. Is that this person is out of my mindset, out of my sort of day to day, and I'm not holding on to this. It has actual health implications, so much so that it was an actual randomized trial that showed this in the REACH model, which is really interesting.
I had Trevor Noah behind me in one of our magazines. But we've also talked about, and we're laughing, what's the role of laughter in helping our mood, in helping our immune function?
It's huge, and I love Trevor Noah. I love The Daily Show, and you and I think whenever we're talking about mood and health, there's always sort of a lightness of the conversation, because that old anecdote of laughter is the best medicine actually does have studies behind it. Is that being able to have humor, for us in psychiatry and psychology, it's sometimes it could be a defense mechanism to sort of cope with the day, but even just from a general standpoint, laughter, keeping things a little bit light and not having sort of too much of an intensity to it, has a big role to play. And I think that's.
Well, I want to thank you for taking the time, as you always have, in terms of helping us understand the role of mental health, the role of our mood. And today, as we talk about it in relationship to immunity, again, a new book, Take Control of Your Cancer Risk. I hope folks will consider getting it and learning a few more tips. And where can folks learn more about you and what you're doing? As I mentioned, you're a contributor here on Medscape as well, which is part of WebMD, and you have a clinical practice at Columbia. But what else can you tell us that folks can learn more about you?
Yeah, I'd love to connect with folks on social media. My handle across all platforms is at Dr. Meerholm, DrMirhom, or drmeerholm.com. And definitely checking out the Medscape or WebMD articles would be one way, because as we're seeing here, the content that's being put out here is amazing, especially the things that you're putting out, Dr. Whyte. So thank you for the opportunity to chat with you today, and I really hope that folks dig into this book because I think it's very beneficial.
We'll talk again soon. Thanks very much.
Thank you.
Bye-bye.
Bye-bye.